Hello everyone, a good day to you all. I'm Viveka Roy Chaudhary from Indian Express Healthcare. Welcome to the second edition of Indian Stents Get Updated. Today we have with us Dr. Prashanth Raju from UK's Kettering Hospital, and he's going to talk to us about the new interventions in cardiology. Dr. Prashanth Raju, welcome to the show.
Thank you very much. Thank you for the invite.
Okay. You have been in UK for more than a decade and you've undergone cardiology training in the East Midlands. Your main interest is complex coronary intervention, and you were among the very few hospitals to use shockwave IVL therapy. So could you tell us a little bit more about it and why is it so much in use today?
Absolutely. So this IVL stands for intravascular lithotripsy. In a common term, it's a shockwave treatment. This is a fairly new technology in coronaries. This has been used to treat kidney stones for nearly 2 to 3 decades. So its safety has been well established already. So recently, what they have done is they put the same transmitters or emitters on the small balloon, so that precisely we can take the balloon where it needed and give the shockwave. So we used to encounter very calcific debris or narrowings in the coronary arteries, where you can take a normal balloon and try to stretch it and it wouldn't budge. And if you try to go more, it will burst and cause complications. So the tools which we had was to drill through the calcium, what we call as rotablation. It does comes with drilling is risky because it can go through the artery, and there's so much risk involved. So the other technology was laser. So again, it comes with a risk, but this is much more safer way to deal with that. So there are a lot of trials going on at the moment called Disrupt Coronary Artery Disease trial. But I came across this in one of the European conference last year. So in 2018, November, December, we got that in our hospital, and we had few patients who had a severe calcific disease and who were coming repeatedly to the hospital with chest pains and small heart attacks, and there was nothing else we could do. They are elderly population with a lot of comorbidities. They can't go ahead with a big risky operation. So this is where this came into useful. So it's a very quick way to do. So all you need to do is take a balloon, place it next to the calcium over the wire, and then use the shockwave button. And it emits shock waves. These shock waves, basically electrical energy is converted into mechanical energy. Bubbles expand and collapse. It causes increased pressure. These waves goes across the coronary vessel. Through the soft tissue, it just goes without damaging any obstruction or like calcium. It causes minute fractures, and then it's like if you watch a car windscreen being blasted, it doesn't blast, but you can see small cracks. It becomes weaker. So then it allows us to expand with the balloon, and then we can put a stent in. It's much more safer compared to all the other techniques.
Dr. Prashanth, how many other hospitals in the UK and across the world are using shockwave IVL as of today?
Since the beginning in the last 1 year, last 2 years, it is now widely used in the Europe and in UK, and I'm sure in other countries as well. I'm not sure about US, it's still not FDA approved. I think it's not been used there. But everyone understands the usefulness of this technology, and it's been widely used. I'm sure even in India it's been used now.
Okay. And like shockwave IVL, what are the other techniques and technologies which you think are going to see wide usage in the decade ahead? Because we are at the start of 2020.
Yeah. So the technology-wise, we are not like phones. We can't come up with every 3 months new model. It takes longer time because we are talking about patient safety and usefulness, and it has to go through the robust evidence-based process. I think the stent generations of stents are getting better and better compared to 20 years ago. So that's where the new changes are, and also there are new medications reducing cardiovascular outcomes that are coming into place. So that's, I think, medications, the stents, are the two things I can think on top of my head now.
Okay, okay. And you talked about change not coming so easily into interventional cardiology, precisely because every change needs to be supported by robust evidence.
Absolutely.
And one method to do that is the randomized clinical
Yeah,
trials, which is
absolutely.
RCTs. So what about, we've had a couple of RCTs on stents, especially the Indian stents. We have the Talent RCT, which is now 2 years old, the second year data, which was released in September last year. What is your take on the data that is coming out of these trials, and what does it say about stents that are being manufactured out of India today?
Okay, so for Indian market, as in any other field, it is getting a global recognition now. They are almost in par with the global market. The stent-wise, the talent study which you mentioned from the SMT, this is absolutely good stent. The main, the way it gets separated out is it's ultra thin. It's 60 micron thin compared to rest of the other stents, which are I think 80 to 120 ranges, and also it comes in different lengths. Throughout the length, it's ultra thin, so it's easier to traverse. And it has got a polymer which is biodegradable. So it delivers drug where it is needed and dissolves over a few weeks, leaving no polymer. So complications like in-stent restenosis or stent thrombosis, which are the main dangerous thing in the coronary field, are very, very less. So I think in the talent study, it was compared with the current leader, Science stent, which has got a durable polymer. And it showed device-oriented clinical outcomes, target lesion failure, were all incomparable. So they were non-inferior even at 1 year and at 2 years. So based on this, I think they're now going to start a multi-talent trial. And in talent trial, the main thing was it was a reflective of real world practice. So everyone, it was all-comer trial. So it included all types of heart attacks, ST elevation, myocardial infarction, and non-ST elevation, myocardial infarction, unstable angina, and also all subset of coronary patients, people with complete blockage of coronary arteries, people with complex bifurcation, people with left main disease. So it had all, and also vein grafts, bypass graft, which had failed. So it included all of them. So that's the more reflective of real world practice.
So how can Indian stent manufacturers really differentiate themselves from the other stents that are already there in the world in terms of not just on cost but on other differentiator factors?
Yeah.
What do you feel those factors could be?
I think, as I said, they're already differentiating themselves. So there's no other stents there which has got this 60 micron ultra thin and also doing all this extra work. So I think what the Indian market lacked was robust data, because the Western culture, UK, Europe, and US, they've got a database right from the beginning to do an audit, to do a research. It's very easy. Whereas India is a big country with big population, wide differentiation in practice, so it's very difficult to bring all together and form a sense out of it. So that's why I think the SMT has done randomized trials, and more trials and more robust data, it will allow us to stand out with the rest of the world.
What is your advice for new cardiologists coming into the system, the medical students who are choosing cardiology? What is your advice to them?
Cardiology, you'll never get bored. It is like watching, or it is practicing some high-thrilled movie. So I would say you need to make up your mind, and cardiology will never let you down. There's lots of subspecialties in cardiology. You can choose. You can become a pacemaker specialist. You can become an intervention stent specialist, and now there is a structural valve disease. You can become that, and also heart failure, preventative cardiology. One thing I would say is it's a new technology, new data coming up every day. So with the blink of eyes, you will miss so many new advancements. So you need to keep up with those things.
Thank you, Dr. Prashanth, for speaking to Express Healthcare. Keep tuned to our channel, Indian Stents Get Updated on Express Healthcare. Thank you.